Hi everyone, good wishes. I'm Dr. Premnath, Senior Resident from Department of Community Medicine of Sri Lakshminarayana Institute of Medical Sciences. Today the topic of discussion will be on contraceptives. So before going into topic of discussion, few terminologies related to our topic of discussion are eligible couple and target couple. What is the difference between eligible couple and target couple? Okay, eligible couple are those who are married and in the reproductive lifespan, that is between 15 to 49 years. If the woman is in the reproductive age span of 15 to 49 years, their couples are called as eligible couple. For eligible couples, there is a register maintained in public health system, eligible couple register. Okay. So what is the difference between target couple is that among those eligible couple, those who have at least 2 live child will be called as target couple. The entire family planning methods, that is contraceptive methods, will be targeting this eligible couple and target couple. Okay. For eligible couple, the spacing method will be targeted, and for target couples, limiting method will be targeted. What is couple protection rate is nothing but among the eligible couples, those who are using any of the contraceptive method. So it is an indicator of the use of contraceptive device among the eligible couples. There's also another term called as effective couple protection rate. In that case, even though the couple is adopting a contraceptive method, there will be an effectiveness for each method. If they are adopting barrier method, means it will have 50% only effectiveness. And if they are adopting IUD, it will be 95%. And if they are adopting OCP, it is 100%. And if they are adopting sterilization, it is 100%. So based on that, the effective couple protection rate will be calculated. In order to achieve net reproduction rate of 1, that is 2 family norm. In order to achieve NNRR of 1, couple protection rate should exceed 60%. Okay. At present, according to NFHS 4 data, the couple protection rate is 53%. If we get that rate to exceed more than 60%, means net reproduction rate will come to 1. Okay. The Pearl index say what is the efficacy of the contraceptive method. Okay, in another term, it gives the failure rate. Okay, so in simple, number of unwanted pregnancy among those couples who adopted any method of the contraceptive. So it is an unwanted pregnancy. How many events occurred? So it will be expressed usually in 100 woman years. Okay, it will be expressed in 100 woman years. And fourth will be cafeteria approach. This is important with respect to family planning method. Cafeteria method is nothing but a basket of contraceptive methods available. Okay, in public health system, many contraceptive methods are available at free of cost at various levels of healthcare system. So among which the couple will get benefit, or all the methods will be explained. It's like a menu card, and they will be assisted to choose the method. Okay, we will not force only this method. You should follow only sterilization, or you should follow only barrier method. It's not like that. There will be a basket of choices given to the couple visiting the clinic, among which the couple can choose any method. Okay, and gather approach. Gather approach. The word gather indicates G is greet. Greet the couple with smile. Ask them what is their need. A is ask. Tell them what is available. H is help them to come into the conclusion. Okay, E is explain in detail about that method they have chosen. That is, what are the advantages, what are the disadvantages, what are the side effects, etc. R is refer and follow up. This is called as gather approach. And last terminology is unmet need. Okay, here unmet need means a couple is sexually active and doesn't want to get pregnant, but not adopting any of the contraceptive method. So their aim is they're sexually active and doesn't want to get pregnant, but they're not utilizing any of the contraceptive method. This is called as unmet need. They have a need, but it is not met. It is of 2 types: unmet need of spacing, unmet need of limiting. Unmet need of spacing means for a newly married couple, there should be at least 2 years before the first childbirth. And between first and second childbirth, there should be at least 3 years. This is called as unmet need for spacing. An unmet need of limiting means those who have 2 live child, at least they should be permanently sterilized, either male sterilization or female sterilization. It is called as unmet need for limiting. Okay, coming into the proper topic of discussion is family planning. It is an individual idea that is voluntarily adopted based on his knowledge, okay, for the welfare of his family and also the social development of the country. So it is a method that is voluntarily adopted. Okay, so contraceptive methods means it is a preventive method to avoid unwanted pregnancy. It is a preventive method. These preventive methods are called as contraceptive methods. It can be broadly classified under 2 heads. One is temporary method and another is permanent method. Under temporary method, barrier method is there. There is male condom, female condom, vaginal sponge, foams, suppositories. Under intrauterine devices, there are 3 generations. And hormonal method, and post-conception method, and at last miscellaneous. Under miscellaneous head, there are natural methods and also coitus interruptus and etc. When we come into the right side arm, that is permanent method, there are 2 things. One is male sterilization, another is female sterilization. Okay, this is a broad classification. One is temporary method and another is permanent method. And this slide indicates what are the family planning methods available under public health sector. Okay, when we come to first method, barrier method, male condom is available. And when we come to IUD, in IUCD 380 and 375 is available. And when we come into the hormonal method, oral combined contraceptive pill Malayan is available. When we come into the newer contraceptives, Antara and Chaya is available. And the emergency contraceptive, easy pill is available. These are all spacing methods. Under limiting method, both female and male sterilization is available. In female sterilization, both laparoscopic and mini lap. In male sterilization, no scalpel vasectomy and conventional vasectomy. These are available in public health sector. We will discuss only the family planning methods that is available under public health sector in this discussion session. Okay. First, male condom. It has a trade name called Nirodh. Okay, it is a trade name called Nirodh. It is a barrier method which comes under temporary method of family planning method, and it has a failure rate. If you see the failure rate, it is high. It is around 2 to 14 per 100 woman years. Okay, the mechanism of action is it prevents the deposition of sperm into the female reproductive tract, that is vagina. So what are the advantages is the patient need not visit health facility each and every time. Okay, and also does not require medical supervision. So it is easily available, safe, inexpensive, easy to use, and also it gives importantly protection against sexually transmitted diseases. And it also has a disadvantage. What is the main disadvantage? It may slip off or tear off. When at the end of the sexual intercourse, when the hardness of the male reproductive tract, that is penis, decreases, there might be a chance for slip off. And also during the act, there may be a chance of tear. These are the main disadvantage. Okay. And also there might be a perceived decrease in sexual pleasure. Now, second, under intrauterine devices, there are 3 generations. First generation, as in this figure, it indicates loop is in first generation. It's nothing but a non-medicated device. Second generation devices are copper T. It comes under 220, 375, 380. Okay, they are all medicated with copper. And the last generation is hormonal method. Under hormonal method, if you see in the figure, the last 2, that is progesterone and levonorgestrel IUD, that is Merina. The other name is Merina. These are hormonal method, that is it has medicated with hormones. These are 3 generations. Okay, under this, copper T 375 and 380 is available in public health sector. Okay, the mechanism of the number 220 and 380, what it indicates is actually surface area of copper. What is the surface area of copper in the device? Mechanism of action, mainly it induces foreign body reaction. Okay, so that it causes both biochemical and cellular changes. Cellular changes at the level of endometrial lining, biochemical changes at the level of, it causes biochemical changes in uterine enzymes, and also it causes biochemical changes in cervical mucus secretion. It causes thickens. By this method, it affects the motility of sperm, capacitation of sperm, fertilization, and also it makes the endometrial layer unsuitable for implantation. In short, it causes foreign body reaction and induces biochemical and cellular changes. The failure rate when compared to barrier method is much less, that is less than 1 per 100 woman years. What is the effectiveness of this method is 95% it is effective. What is the advantages? The patient need to visit hospital, yes, of course, but doesn't need hospitalization. Okay, just then after the procedure, the patient can rest for 10 to 20 minutes and come back to their home. Okay, and need not visit frequently. So it is easier to fit, no hospitalization, cheaper when compared to first generation devices. The second generation, third generation devices have low expulsion rate, and it also has no metabolic side effect profile. When we compare to oral pills, it causes metabolic side effect profile. We will discuss in later slides. And it also a main advantage of reversible contraceptive effect. Okay, there are some methods like at the end we will discuss depot medroxyprogesterone acetate Antara, where the reversibility of fertility may take time, but in case of IUD, there's nothing like that. Once a device is taken off, the fertility will be reversed. The patient or the woman will become fertile. And it has some side effects because on device is inserted in intrauterine cavity, no? So it has side effects like bleeding. The most common side effect is bleeding, and it is experienced by most of the candidates in whom intrauterine device is placed, and it is experienced for 1 to 2 months. After that, it will gradually decrease. In case there is a heavier bleeding or profuse bleeding, in such case, the intrauterine devices can be removed and patient can be motivated to other methods. Okay. Pain is also one second most common side effect. And perforation is an important side effect because if the physician who's not well trained in this method, and if they perforates uterine cavity, it may go into abdomen. So perforation is an important side effect. And pelvic inflammatory diseases, ectopic pregnancy, or other side effects. So the contraindications will be those who have pelvic inflammatory disease or absolute contraindication. Those who have abnormal vaginal bleeding, those who have pelvic tumors, because there will be distortion in uterine cavity. So that it will be expelled, and it will be difficult to place the intrauterine device in uterine cavity. So if in case of pelvic tumor, in case of malignancy, in case of previous history of ectopic pregnancy, or any previous history of thromboembolic events, they are all absolute contraindicated. They should not be prescribed this method. When we see the paths of IUD device, the first figure indicates there are two things. One is horizontal arm and vertical stem followed by string. The string, the patient should be made aware. The patient should be motivated to check this string. Okay. And in general, there will be a measurement insert will be there. There will be a cervical gauge. That blue color thing is called as a cervical gauge. There will be an insertion tube and plunger. Once this IUD is inside the uterine cavity, plunger will be pushed so that the horizontal arm will open and form a T shape. Then this plunger will be removed, followed by insertion tube will be removed, so that IUD will be in that place. And patient should be motivated to check the thread. Who's an ideal candidate? If you remember the contraindication, you can say they should not have pelvic disease, and they should have a normal menstrual period, and they should check the IUD tape. And importantly, they should also be in monogamous relationship, because the chance of PID is most common if they have a polygamous relationship. And this method is prescribed importantly to those who have at least one live child. Okay, for nulliparous women, it is ideally not indicated. It is indicated to those women who have at least one live child. And how frequent it should be changed. Each device has a frequency of shell life. For example, copper 380 can be placed for 10 years. It can be replaced once in 10 years. Though the patient or the woman will not be using it for 10 years, it has a period for 10 years. It can be placed. And 375 as in 5 years. Last two indicates a third generation IUD devices, that is progesterone and Mirena. Progesterone should be changed every year once because the progesterone dose will be decreased gradually. In Mirena, the composition will be levonorgestrel and it should be changed 7 years once. And what is the ideal term of insertion of IUD devices? It is within first 10 days of menstruation. It should be placed within first 10 days of the menstruation. In case of pregnant women, there are two terminologies. One is postpartum insertion and post-puerperal. Postpartum is within first week of delivery before the discharge of the patient. Okay. Post-puerperal is nothing but after 6 weeks on follow-up visit. Post-puerperal is after 6 weeks. Once this IUD device is placed in the woman, she should be advised when to consult a doctor. The follow-up visit is nothing but on the first month of the menstruation after IUD device is placed. The woman should come to the consultation on first month of menstruation, followed by every year once till the IUD device is in place. And also she should be given advice on if there is any missed thread the patient is not able to feel, or if she is experiencing any side effects, or if she experiences any missed periods, in that case, should consult the physician immediately. Now we'll come into the third, that is hormonal method, OCP, combined oral contraceptive pill. Mala N is available in public health sector. N is not for sale. Remember, N is not for sale. It is free of cost. The composition is levonorgestrel and ethinyl estradiol. It contains both progesterone and estrogen component. Estrogen component is around 20 microgram and progesterone levonorgestrel is 0.15 milligram. And each pill contains 21 tablets and 7 non-hormonal tablets. Now that is nothing but iron tablets, which contain 60 milligram of iron. So the timing is, it is given on 5th day of menstruation and continued for 21 consecutive days, followed by 7 break days. In this break days, this non-hormonal tablets can be used. So it contains 28. It should not be started on day 1. It should be started from day 5. And what is the mechanism of action is that it has a central pathway of action. That is, it inhibits or suppresses the LH surge. If LH surge is not happening, ovulation will not happen. So it acts, action is hypothalamic pituitary ovarian axis. It has a failure rate of 0.3 to 8 per 100 woman years. And when compared to permanent sterilization, it also has 100% effectiveness if it is taken as prescribed in regular phase. And it is an oral pill, no? So it will have a side effect profile. Main side effect profile will be thromboembolic event, and it has a pharmacokinetic action on liver. So these two events will be most common. Because of thromboembolic events, there might be a chance for myocardial infarction. There might be a chance for cerebral thrombosis. There might be a chance for deep vein thrombosis. And as it has a metabolic effect in liver, it may cause dyslipidemic profile. It has a chance for to cause hepatocellular adenoma. It has a chance to cause gallbladder disease and cholecystatic jaundice. Also, in previous researches, it has been found that it has an increased risk for cervical cancer. And estrogen is there, no? So lactation might be affected. It is not prescribed for a breastfeeding woman. It is not prescribed for breastfeeding woman. And other common side effects like breast tenderness, weight gain, etc. also seen. So what are the contraindications? If you remember the two side effect profile, no, thromboembolic event and liver, we can write the contraindication. So if the patient is having any known liver disease or known history of thromboembolic event or any cardiac abnormalities, they are all absolute contraindication. And those having any breast cancer or genital cervical cancer are also contraindication. And if they have any undiagnosed abnormal uterine bleeding, also contraindicated. Now we come into the fourth method that is available in public health sector, that is emergency contraceptive pill. Under this, easy pill is available. What is the composition of easy pill is levonorgestrel. The dose is 0.75 milligram. 0.75 milligram. And the important thing to remember in emergency contraceptive, it is not a regular family planning method. It should not be advised or suggested on regular basis or in each month basis. It is an add-on. It is our backup. It is an add-on or backup. When it should be utilized, we can see. Okay, on emergency use only, such as patient or a client had an unprotected sexual intercourse. The unprotected sexual intercourse and are not following any of the contraceptive method, or if it is inconsistent or incorrect use of contraceptive methods. For example, if patient is taking OCP and if she missed 2 to 3 pills, means she may in that month this emergency method can be adopted. And in case of any contraceptive failure, that is IUD device is expelled, in that case it can be used. And in case of sexual assault, these are all the important indications for emergency method. And it has 3 methods. One is we can take high dose of progesterone, that is levonorgestrel 0.75 milligram can be taken 2 doses. First dose within 72 hours and second dose after 12 hours of the first dose. This is the first method. Second method, even OCP can be taken, but high dose, that is 4 tablets should be taken within 72 hours and it should be repeated after 12 hours of the first dose. 4 tablets should be taken after 12 hours. That is estradiol. Ethylene estradiol dose should be 120 microgram. 4 times the dose should be taken. This is called as UCP regimen. And third method, even the IUD device can be placed within 72 hours. Why this 72 hours they are stressing? Because if you understand the mechanism of action, you can understand this. It interferes with the ovulation, it interferes with fertilization, but does not interfere with implantation. Once the fertilized zygote gets implanted in the endometrial lining, it has no action. So only they are saying it should be taken within 72 hours. If it is missed within 72 hours, if the patient missed that period, means this method has a low effectiveness. Okay, and it is found that it's get implanted, means the patient should be counseled for medical termination of pregnancy. This emergency pill is not an abortifacient. Okay, it is not an abortifacient. It has no role in implantation process. Once it gets implanted, means the patient should be counseled for MTP, medical termination of pregnancy. So only the time period 72 hours is stressed. The doses levonorgestrel 0.75 milligram should be taken within 72 hours, and second dose is after 12 hours of the first dose. The important side effects are irregular bleeding and spotting. Irregular bleeding and spotting is seen, and delay in menstruation. This too is common because high dose of hormones we are using. So important recollect points are it is not a regular family planning method, and it should be used within 72 hours. It does not cause abortion, and it should not be used in regular. It should not. It is a substitute only. Now we come into the fifth device that is available is newer contraceptive. Chaya and Antara is available. What is Chaya is nothing but a non-hormonal pill. It has other names like it is an anti-implantation agent. It is also called as once in a week pill, etc. Chaya is a trade name. It is discovered in CTLRI, Central Drug Research Institute, Lucknow. Okay, it is developed in India. It is a non-hormonal pill. Okay, like progesterone only pill, this also can be given to the breastfeeding woman. The composition is ormeloxifene. Ormeloxifene is a composition. It is an SERM, selective estrogen receptor modulator. So it is a non-steroidal, non-hormonal. It can be taken once in a week. What is the mechanism of action? It causes asynchrony in the development between zygote and endometrial maturation. That is, it acts in the level of endometrial lining, the uterine cavity, not in central action. It causes asynchrony in the maturation of endometrial. If there's an asynchrony in maturation, means the fertilized zygote does not have a favorable environment to get implanted. So only this other name is anti-implantation agent. What is the failure rate? It is 1.6 to 2.8 absolute, approximately. What are the advantages? It can be used in breastfeeding women. As it as an SERM, selective estrogen receptor modulator, it is also used in the treatment of breast cancer. And also it has a few side effects. That is, it may cause delay in the periods. Or that is, normal regular menstrual cycle might be disturbed. There may be delay. And what are the contraindications, sir? PCOD and cervical hyperplasia are contraindications. The other name I don't know, once in a week pill. Why? Because though it is a once in a week pill, the patient should be advised to take twice a week in first 3 months, followed by once in a week. For example, if you see in the slide, the patient is starting on Sunday, any day of the menstrual cycle. That is on first day. It should be started on first day. For example, the menstruation is on Sunday, means the first tablet should be taken on Sunday, and second tablet should be taken 3 days after the first dose. That is on Wednesday. This should be repeated for first 3 months. After that, it can be taken on Sundays. So for first 2 months, it is used twice in a week. After that, once in a week. The dose is 30 milligram. It has an ormeloxifene of 30 milligram. And last will be injectable contraceptive device. Antara is available in public health sector system. The composition is medroxyprogesterone acetate. Report medroxyprogesterone acetate. It is an injectable. Till now, what we are seeing was not an injectable, but it is injectable. It is an progesterone only pill. So it can also be given to the breastfeeding woman. The dose is 150 milligram. The route is intramuscular route. So what is its mechanism action? If you remove the progesterone component, you can write. As it has progesterone component, it inhibits the LH surge, so ovulation won't happen. As it is as a progesterone, it causes thickening in cervical mucus secretion, so that sperm entry will be prevented. And also there will be thinning endometrial lining. So it has all the 3 actions. The failure rate is 0.3 to 3 per 100 woman years. And when it should be used, it should be used within first 5 days of the menstrual period. And it should be repeated 3 months once. So it can be repeated 3 months once. So the main benefit is the patient may not, or the woman need not maintain a reminder or calendar. In OCP means each day should be reminders should be there, etc. When we compare to that, it is once in 3 months. So it is safe, highly effective, and it is suitable for women who are not eligible to use estrogen method. Any estrogen containing contraceptive, they are in the contraindication. Like for example, if their thromboembolic event is common or liver profile is abnormal, means they can be given DMPA. This Antara can be given. Okay, what are the non-contraceptive? It also has non-contraceptive benefits. As I told you, it can be given for endometrial cancer, it can be given for ovarian cancer, benign breast diseases, ovarian diseases, endometriosis. These are all non-contraceptive benefits. As I said, everything, this also has a side effect, that is return infertility is common. As I told you, in IUD device, the reversible infertility is once a device is taken out, fertility will be reversed. But in this case, if the woman is following this method for a period of 1 year, say let us say 1 year, 4 doses is taken, means there is a chance to return infertility in 3 to 4 months. If the patient wishes to have the second child, means there might be a delay in return of fertility. That is an important side effect in Antara. Now we have seen one left arm, that is temporary methods we have seen. Barrier method, IUD device, hormonal method we have seen. Now we come into the right side of the arm, that is permanent method. There are 2 things. One is male sterilization, another is female sterilization. Under male sterilization, non-scalpel vasectomy is available. It is a daycare procedure. Once after the procedure, patient can come back home and resume his activity after 7 to 14 days. That is, even after third day, the patient is able to walk, do these regular activities. Also, non-conventional vasectomy is available, but the patient is using non-scalpel or wish to use non-scalpel vasectomy means there might be a chance for the live sperm in semen. So he should be advised any one of the contraceptive method, Barian method, for at least 1 month. And another counterpart will be female sterilization. Under this, mini lap tubectomy is available, laparoscopic tubectomy is available. So these are the broad classification that is available in public health sector at different health system level. We will see in detail what are the other methods that is available in successive session. Thank you. Let us meet.